Good morning, friends. Well, we are going to talk about Orofer S injection, which is safe, swift, and simple. Well, before going to the parenteral iron, that is Orofer S, we need to discuss about anemia. According to WHO, during any stage of pregnancy, the hemoglobin levels should not go below 8 gram percent, and the normal target should be approximately 11 grams percent. If it goes below 8 grams, it can lead to both serious maternal and fetal problems. Well, maternal problems like shock during pregnancy can lead to death of the mother, whereas in a fetus, it can lead to IUD, that is intrauterine death. Well, Andhra Pradesh has got the lowest prevalence of anemia, that is 33%, whereas Rajasthan, on the contrary, has 98% of anemia. 87% of the women who are pregnant suffer from anemia, and anemia contributes approximately 16% to the maternal deaths. Well, the incidence of premature deliveries in these ladies is 3 times higher than the non-anemic and is approximately 34.5%. Well, in children and in the preschool going children, the anemia accounts for approximately 76 to 68%. Well, what are the factors which are responsible for contributing or to developing anemia in patients? Well, it can either be an increased physiological requirement, there might be a dietary insufficiency, a lady might be a multipara, which means she had multiple deliveries in the past or pregnancies to be precise. There might be a deficient absorption, example, you have achlorhydria. Then there can be chances of bleeding from any other source. That means it can be she might have a mild to moderate bleeding from the GI tract. It can be bleeding piles, it can be ulcers, or it can be bleeding from the gums, which all can contribute to the development of anemia. Then, of course, deficiency of folic acid, vitamin A, vitamin B12, and vitamin C, all are the contributing factors which can lead to anemia. Infectious diseases like malaria, then parasitic infestations with the hookworm, then Helicobacter pylori infection of the GI tract, and of course, and the last one, concomitant intake of antacids, which reduce the absorption of the essential vitamins, can also contribute to the development of anemia. Well, what are the implications during pregnancy of anemia? Well, it can lead to infections, it can increase the maternal mortality, it can increase the fetal mortality, it can lead to preterm deliveries. Anemia can be associated with preeclampsia, a stage in which you have proteinuria along with high blood pressures. Then you can have complications during all the stages of labor. The babies born to the anemic mothers are low births and low birth weight babies. Of course, there can be incidents of postpartum hemorrhage, which means there is blood loss, which affects really badly the health of the female. Then there can be definitely in future physical and psychomotor growth developmental disorders or implications in the infants. Then what are the implications for the child? Well, it can lead to IUGR, it can lead to low birth weight babies, it can lead to preterm deliveries, impaired mental and psychomotor developmental functions, mental retardation, impaired sleep patterns and affective relationships, limited attention span, and you have a decreased capacity to fight the infections, hence you have a weak immune system, you have an increased morbidity from infectious diseases. The patients or the child can have long and severe lasting diarrheas, and finally he or she, the child, can develop symptoms and signs of cardiac failure. Well, what happens if a pregnant lady in third trimester with severe anemia is anemic? Well, what are the reasons? Well, it can, the lady might have a poor response to the oral iron, she can be intolerant to the oral iron, there might be a poor compliance, there might be GI disorders, or of course there can be some sort of a blood loss. So what are the alternatives to iron injections? Well, the alternative is blood transfusion. The blood transfusion can be autologous, it can be heterologous. Well, there are problems associated with blood transfusion also. First is the availability. Second is what quality of blood are you getting from for the patient. And third is there is always a window period for complications. So blood transfusion is not reliable. So what now? Well, a safe treatment option in severe anemia, and which can also be used in postpartum anemia and IDA resistant to oral iron, which can be a superior alternative to blood transfusions, is definitely parenteral iron. So presenting to you Orofer S, which is safe, swift and simple. Amcure's iron sucrose USP is bioequivalent to international brand. It restores your patient's hemoglobin and ferritin levels during pregnancy. It is the number 1 parenteral iron of India. Well, this iron sucrose has its specifications comparable to the international iron sucrose available. Well, you can see the molecular weight of the international is 57,916 Daltons, whereas molecular weight of our Orofer S is 57,338, which is comparable. Specific gravity 1.142 of the international and 1.138, which is also comparable of our Orofer S. Then alkalinity, pH 10.9 and 10.8. Then we have the osmolarity, we have the assay of sucrose, limit of ferrous ions, content of the chlorides. All these are comparable to the international standards. Our iron sucrose undergoes 15 critical characterization steps, and these steps include detection of bacterial endotoxins, alkalinity, absence of low molecular weight ferrous and ferric complexes, particulate matter, chloride content, and assays for iron sucrose and the limit of iron 2. So all this ensures maximum efficacy and safety. Now, what is iron sucrose? Well, iron sucrose is a complex of polynuclear hydroxide in a sucrose for intravenous use. The iron in the polynuclear cores is bound in a similar structure to that of physiologically occurring ferritin. The complex is stable and does not release ionic iron under physiological conditions. Following IV administration, iron sucrose is dissociated by the reticuloendothelial system into iron and sucrose. Well, reticuloendothelial system consists of liver, spleen, and bone marrow. Well, you can see it here when we are considering 4 types of parenteral irons. You can see that iron sucrose is taken up by the reticuloendothelial system. The blue bars indicate the RES, whereas the red bars indicate the parenchyma. When you are administering iron gluconate, this iron gets deposited in the parenchymal cells, so it reduces, it increases the incidence of adverse reactions, and when it is taken up by the reticuloendothelial cells, then there is a reduction in the adverse events. So iron sucrose is definitely superior to iron gluconate and iron citrate. Well, iron dextran, which was an ideal parenteral iron before ferric carboxymaltose, and you can see here also this iron is taken up by the reticuloendothelial cells as compared to its absorption in the parenchyma. So definitely iron dextran is a superior molecule, but we can say that it did not continue on the prescriptions of the doctors. The reason being that it caused severe anaphylactic reactions due to the dextran moiety present in the iron dextran. So it was banned, and now we have a superior molecule than iron dextran. We have iron sucrose, as well as we have iron ferric carboxymaltose. Now this is a table which we have always seen. This is the erythropoiesis, how hypoxia is stimulating erythropoietin secretions. Well, it is around here on day 20th, when there is a conversion of proerythroblast to reticulocytes. The iron gets incorporated, and this iron is made available either from the parenteral iron or by the oral iron what we take, and it gets incorporated in the reticulocytes, and then the reticulocyte leaves the circulation on day 21. leave the bone marrows and are found in this blood circulation after day 21, and over the period of 4 days they mature into RBCs, which are red blood corpuscles, and who have a diameter of approximately 7.8 microns. Now Orofer S is available in 2.5 ml, 5 ml and 10 ml, and 2.5 is equivalent to elemental iron 50 milligrams, 5 ml is equivalent to 100 milligrams, and 10 ml is equivalent to 200 milligrams. Well, Orofer S injection, it can be given a dosage of Orofer S injection. It can be calculated from the Ganzoni formula. During pregnancy, this is equal to targeted hemoglobin minus the actual hemoglobin into 2.4 into body weight plus 500 milligrams. This is for the iron stores. Then weight here is the pre-pregnancy, and the D is the deficit of the hemoglobin, that is targeted hemoglobin minus the present hemoglobin. Now in cases of severe postpartum anemia, also you can give Orofer S injection. Here the target hemoglobin minus the actual into 2.4 into the body weight will give you the dosage of Orofer S injection. Why Orofer S is different? Well, Orofer S has worldwide safety profile. It does not require a test dose. It is convenient dosage and has convenient dosage and administration profile. Very low adverse event reactions with no fatalities. It is a category B drug in pregnancy, unlikely to cause harm to the unborn. It can be given 1 to 3 times in a week, and maximum dose is 600 milligrams. Well, you can see here the table from your visual aid. Orofer S 200, safe, swift and simple. It ensures maximum efficacy and safety. It has got study published in the International Journal of Reproduction, Contraception, Obstetrics and Gynecology 2013. It shows safety and efficacy of iron sucrose in pregnancy. There was a hemoglobin rise from 8 gram percent to 10.80 gram percent, whereas the ferritin stores, they increased from 6.25 nanograms per ml to 155.33 nanograms per ml. Well, all this because of the 15 critical characterization steps which ensures its safety. Its quality matches the standards of the international brands, as we have discussed. So this is a safe parenteral iron. It has got negligible incidence of anaphylactic reactions. It does not require a test dose. It is a category B drug which is safe in pregnancy. Now, what are the indications? It can be indicated in severe anemia, in pre and post-operative anemia, iron deficiency anemia in patients intolerant to oral therapy, postpartum anemia. Well, to every postpartum patient, please administer 1 vial of Orofer S 200 milligrams at the time of discharge and reduce her pill burden. Well, this is a requisition which can be discussed with the doctor when you are there in his clinic to prescribe the injection and gain a commitment that Orofer S 200 should be prescribed to all those ladies after delivery, so that you can reduce the number of pills which the lady needs to take after her delivery. So this is a swift parenteral iron, and it has been confirmed in the BJOJ, that is British Journal of Obstetrics and Gynecology, which confirms that iron sucrose gives a quick rise of hemoglobin of 2.6 grams in just 5 days in PPA. Well, the dosage and administration, I would like to highlight again, it can be given as a bolus slow IV injection, 200 milligrams undiluted, to be injected slowly over a period of 10 minutes and may be repeated thrice weekly. Or it can be given as a slow IV infusion, 200 milligrams to be diluted with a maximum of 200 ml of normal saline immediately prior to infusion, and to be infused over a period of at least 30 minutes and may be repeated thrice weekly. Well, the total single dose should not exceed 200 milligrams, or it should not be given 3 times per week, more than 3 times per week.